Many times when I have a TMJ patient come into my office, they don't actually really know why they're there, because they're saying, hey, I got ear pain. How in the world does that have to do with my TMJ joint? So I start discussing with them, number one, the proximity. So your joint, which is right here in front of your ear, is separated by your inner ear by a very thin little bone. And shockingly, that little bone is separated by a little suture, so where two bones come together. Inflammation can actually go from the joint into the ear. So I'll get lots of patients coming from ENT saying, hey, my ENT looked in my ear and they said it looks fine, but I have pain in there. Well, it tends to actually be inflammation coming from the joint going into the ear. Now, many other patients have pain that kind of goes down below the ear and things like that, where they think, hey, this is the ear. That is almost always some kind of muscle dysfunction, meaning overactivity of the muscle. No different than if you decide to run a marathon every day. Yeah, things are going to get a little bit sore. Well, in this case, the marathon is almost always some form of clenching or grinding or something like that you do while you're sleeping and you don't even really know you're doing it. So if we don't tackle some of these issues, we're never really going to get a proper diagnosis for you, and we're never going to get you better. And that's what we do here at our practice. We look at the ears, we look at the joint, we look at the airway, we look at the tongue, we look at the muscles. We're trying to get a full picture of our patient so that we can make sure that we're tackling the right problems.